Thank you actually for this very interesting event, I would say. Allow me to thank everyone who survived till after lunch. It's always a challenge to organize a panel after lunch and to see who are the real survivors. So thank you for صمودكم معنا. We promise it's an interesting panel and a very hopefully relevant and useful discussion, especially that I'm joined by a group of distinguished guests who surround the topic very well. I will start simply by saying, referring back to His Excellency Minister Absat in the morning. He said we need to focus on implementation. We need to go beyond diagnosis. And I think the most equipped to do that are a group of pharmacists, because we realize the relevance of moving beyond diagnosis and ready prescriptions. We always focus on the right therapeutic guidelines. We always focus on efficacy. We always focus on making sure there are the right regulations. So we'll be trying to tackle the contribution of the pharmaceutical sector to the national economy and to reviving the economy through this lens, through the lens of regulation, of efficacy, and making sure that we have everything, the right therapy in place, but on the economic level this time. I'll be very brief and simply positioning the sector, and then I'll open it up for our distinguished guests, starting by saying that the pharmaceutical sector, and I refer to what Dr. Makram said, a priority for the people, not a priority in terms of regulation and making sure its contribution to the economy is actually well maintained, and the needed regulations to maintain quality are actually well maintained. It's a sector that used to contribute a bit more than 1 billion. We were discussing today 1.5 billion before the crisis to the national economy, going down now to almost 1/3, less than 0.5 billion, because of various reasons. It's a sector that used to be a major pillar of Lebanon's positioning as a health center of the region in terms of services, of quality, etc., and with potential for growth. And now a sector that's actually still having a lot of potential, but struggling to survive and struggling to maintain and struggling to counteract the influence of different regulations that weren't well studied, I would say the least, and that have a major influence on the sector. Despite that, we stand now at a position where there is plenty of potential, there's plenty of possibility, and there's plenty of current structural challenges that need to be addressed. To discuss all of that, we have a set of guests, starting with Dr. Rasha Hamra, who I'll briefly introduce all the guests and then open it up for the different interventions, starting with Dr. Rasha Hamra, who's a public health practitioner and a pharmacist with more than 13 years of experience at the Ministry of Public Health and several years of experience at WHO as a regional specialist. She has led several pharmaceutical reform initiatives and currently works as an independent, as a consultant in the sector. I would also add that she's the author of, I would say, the only paper that described the sector after crisis. And hence, we'll be listening to your contribution, sharing the content of this very interesting paper and capitalizing on it. We're also joined by a set of discussants, starting with Dr. Joumana, who's a senior executive in regulatory and external affairs with more than 20 years of experience in the region, GCC, Levant, and North Africa in regulatory affairs. She currently handles regulatory affairs at Algorithm and contributes to regional policy on pricing, intellectual property, and localization. 3 topics of interest that we'll be tackling in detail, what's needed in the country in particular to advance those. Also joined by Dr. Tarek Tabbara, who's the CEO and board member of Serum Products, which is a leading, he currently leads strategic growth across MENA. He's also a board member and the treasurer at SPIL, the Syndicate of Pharmaceutical Industries in Lebanon, where he advocates for local manufacturing policies. The serum sector, the serum manufacturing sector, is a success story in the country. We'll be highlighting this more and trying to learn from the sector and trying to discuss the policies needed to expand this success story and capitalize on it. Dr. Soula Kyriacos, who's a consultant and associate professor with more than 25 at LAU. She's actually a founding chair of the School of Pharmacy at LAU, and she's a renowned academic and professional in the fields of research, quality, and pharmaceutical innovation, as well topics of interest to our policy discussion that we'll be trying to delve into. And last but not least, Dr. Hussein Jundi, who's the regional country manager at Merck for Levant since 1998, He oversees commercial strategy and operations in the region. He's also a vice president and treasurer of Lebanese Pharma Group. We will build on his experience navigating the sector challenges and contribution to the economy. Thank you for joining, and looking forward to everyone's contributions. We'll start with Dr. Hamra, your presentation of the paper, and we'll take it from there.
Ladies and gentlemen, it's my great pleasure to be here today to present to you the policy paper that I developed with the Lebanese Center for Policy Studies, and thank you for giving me this opportunity. It talks about the impact of the economic crisis on the pharmaceutical sector in particular, and it described the challenges, the opportunities. Believe it or not, there were opportunities amid the crisis, as well as strategic solutions and recommendations. Just allow me to start by disclaimers. Is that when I wrote the policy paper, I was an independent expert, but I rejoined the WHO. So the policy paper actually does not represent WHO views, just to be clear about it. The findings, the opportunities, as well as the reflections actually reflect the situation before November 2024. Yet, because a lot of changes actually happened since then, yet the policy brief still remain as a valid, documented policy paper about lessons learned and the way forward in order if we want to prepare for future crises, inshallah la, as well as it's really a guide and it's still relevant for all ongoing reform efforts in the pharmaceutical sector in Lebanon. So just to take you briefly about what I call it consecutive shocks that the health sector in general faced in Lebanon, starting in 2011 with the influx of 1.5 million Syrian refugees, hosting the biggest number of refugees per capita in the world. Why it was a shock for Lebanon? Because simply the healthcare structure was not ready, as an infrastructure, was not ready to provide the health needs for such a vulnerable population. So it constrained an already weak sector in general. Then we were faced with the first COVID-19 lockdown in March 2020. Unfortunately, this was followed by the Beirut Plus in August 2020. And then in June 2021, unfortunately, the World Bank classified Lebanon as a middle to low income country after being middle to high income country for 25 years. This was a really shock in Lebanon, for Lebanon. Also, the World Bank reclassified Lebanon and said that we are among the 10 worst economic crises in the past 150 years. And then, unfortunately, with the recent conflict that started from October 2023 and lasted till November 2024, although I believe that we are still in the continuous same conflict, again, by the World Bank, it was estimated that the economic cost of the last war costed us around $14 billion. And for the reconstruction and the recovery, we need at least $100 million. So briefly, just to tell you about the impact of all of these shocks on the pharmaceutical sector in particular, is that definitely we faced a problem in the affordability of medication. And one study showed that actually the medication cost increased by more than 1,100% only from 2018 to 2022, which is a lot of increase. And only, and I don't know if this is still valid, only around 130 medication are still partially subsidized out of 5,500 medications that are registered in the country. And this is caused a lot of having the high cost of medication. And this resulted that 85% of the health costs are actually out of pocket. Before crisis, it was estimated to be only 35%. Also, the impact on the crisis on the pharmaceutical sector in particular, we had the availability of medications, and we all heard about the severe shortage of essential medications. يعني سمعنا عن المورفين انقطع من البلد, a lot of cancer medications, a lot of medications related to chronic conditions were out of stock. And maybe now we'll hear more from the international pharma. Actually, they ended up with debt to international supplier of more than $400 million. And this affected Lebanon because they were not able to import more medication in the country till they cover that deficit. And then the reliance on the Ministry of Public Health Services increased from around 40 to 50% to more than 70% of the population, because a lot of people were not able to afford their private sector. The NSSF was not able to cover, so everyone left to the Ministry of Public Health. Mind you that the budget of the ministry decreased drastically. Also, we talk about brain drain, like what happened in other sectors. And according to a study that was done in 2020-21, that 41% of pharmacists said that they are willing to leave the country. And we heard about documented cases of around 700 pharmacies who were closed because of the economic crisis, as well as more than 2,000 people who lost their jobs because of the international pharmaceutical scientific offices unfortunately closed in the country. Other findings on, because of the impact on the pharmaceutical sector, the impact was directly on the patient. And as Nabil said, because this sector serves a lot of population, and really it's the vulnerable population, and we are talking about the sick people. So in terms of the quality of medication, this crisis, and because of the shortage in medication in the market, actually a lot of people seek to have informal channels to get their medication. So هون عم نحكي على دواء جايبينه من برا, not regulated, we don't know it's actually the source, and it's definitely the price was not regulated. And a lot of people thought, okay, I'm not finding my medication in Lebanon, let me get it from abroad. And this opened the door for having maybe counterfeit medications. If not counterfeit, then we were having problems with the storage conditions, that we don't know how the medication was actually stored. It affected a lot the health-seeking behavior of people, and there was studies that showed that around 50% of the population of patients only went to pharmacies to get their medications, and the other half actually went to NGOs or get their medication from abroad or even from unknown sources. And actually, a lot of patients decided that they will cut actually on their medication. So for example, a study done on hypertensive and diabetic patients, they said that they changed their treatment regimen without going back to their doctors to ask them. And this resulted in either skipping doses or even taking half of the dose حتى علبة الدواء تضاين معهم أكتر. And unfortunately, this resulted in having really direct impact on the health outcomes. So we had a lot of reports about complications of diseases that are otherwise preventable. Examples منهم صار عنا كتير reported recurrent myocardial infarction, just simply because people were not able to get their antiplatelets from the market. Diabetic ketoacidosis due to the lack of insulin. We have also about a lot of seizures because of lack of antiseptic, as well as having septic shocks because of lack of antibiotics, because it was in shortage. So despite all of the negative impact on the pharmaceutical sector, actually there was a lot of windows of opportunity. And here I always believe that with every crisis, there comes windows of opportunities. And the first window of opportunity was really for the local manufacturers. And it was estimated that in 2018, their market volume was only 10%, and up in 2024, their market share increased to 30%. So actually what happened is that we had shortage in the country. So the local manufacturers stepped up because they have the capacity, and they tried to fill as much as possible of the needs of the Lebanese population. And let me remind you that actually the price of the locally manufactured are usually 40% less than similar brands, and it's at least 10% less the price of generics that are imported from reference countries. Another window of opportunity is that the use of generics in the country also increased from around 8% till around 25%. And this is a good indicator that people started going to generics that are usually cheaper. But there is more potential to increase this share up to 50% in comparison to other countries. And I'm talking about the USA and all EU countries. Also, there was a decision from the Ministry of Public Health that we need to go to digitalization. And here was the example of the use of the Ministry of Public Health of the MediTrack, where mainly they followed all the cancer medication in order to make sure that there is no abuse in the country, or that the medication is actually not sent or used in other countries. So the policy concluded with recommendations that we believe that it's still valid, because these recommendations came not because of the crisis, but because of a chronic problems that we had in the pharmaceutical sector even before the crisis. But the crisis magnified the gaps and for us to tackle. So the recommendations were divided into 3 categories. Short-term recommendation, which mainly focus on increasing and strengthening regulatory oversight. And here we are talking regulating all the pharmaceutical supply chain, from improving GMP, from the inspection up till drug promotion, and improving and expanding pharmacovigilance. Also, another recommendation on the midterm is that we need really to work on supporting more the local manufacturers, because we saw their potentials. And actually, there's an aim in Lebanon that we really need to be self-sufficient, focused on local manufacturers when it comes to essential medication. And definitely on the long term, we talk about the importance of activating the Lebanese Drug Authorization Authority that actually was issued by a law in 2022. And recently in last September, we had implementing decrees. But I would like to say that this will take years to see the light for the authority to be really activated, to have the right people in the right place to draft all the SOPs and the terms of reference that are needed. And definitely when we talk about a policy recommendation and we talk about the unique position of Lebanon as really being the hospital of the Middle East, we cannot ignore the importance of having the international pharmaceutical companies in the country. Unfortunately, we lost a lot of scientific offices. We need to support and foster their presence. We need to encourage them, because simply their presence means that the Lebanese patients are able to access innovative medications that the local manufacturers don't know how to or cannot produce. So this is a must. And when we talk about international pharmaceutical companies and we talk about local manufacturers, both of these entities would like to have a strong research and development in the country. So again, we need to focus on strengthening research. Also, we talk about the activation of the Central Quality Lab. It was closed long time ago for political reasons. And we are all calling for the government to take the will and the decision to reactivate that Central Quality Lab, because it's essential. Currently, Lebanon rely on importers to test the medication, the quality of the medication in the reference countries, but we need the testing to be done in Lebanon. And finally, I would like also to recommend introducing taxation on harmful products. We talk about tobacco, alcohol, and even sugary drinks to subsidize expensive medications. And this should be a part of the universal health coverage law that we are all looking forward for the government to hopefully to submit soon. Last words, I would like to say that any sustainable financial or pharmaceutical reform must definitely strengthen the system, but it should not be on the expense of the patients or increase the burden on the households. We should carry this load. It's very important, and we should ensure at the end of the day, again, as part of the universal health coverage, is that every person residing in Lebanon, whether Lebanese or non-Lebanese, to have access to safe, affordable, as well as reliable medications. Thank you for your attention.
Thank you, Dr. Hamra, for a nice comprehensive overview. A rather sad one, unfortunately, based on the situation, but opening up the room for a lot of possibilities and actual opportunities there. My first question is addressed to everyone and is very broad. It's about reflecting on what Dr. Hamra has said from your own perspectives and your own different hats. So starting with Dr. Tarek, if you'd like to share your own perspectives from your own position on the paper and the recommendations mentioned.
أنا معلي رح أحكي بالعربي.
خذ راحتك.
ما في مشكلة. البيبر يلي عرضته رشا تقريبا صار عمره سنة. أول ما نزل وطلعنا عليه exactly سنة. وقتها لفت انتباهنا لأنه مغطى ما بس وقائع الأزمة اللي قطعنا فيها، بس بنفس الوقت حط أسس لاستراتيجية جديدة بدنا نمشي عليها. وهذا الموضوع كتير مهم لأنه نحن ما بدنا بس نطلع لورا، بهمنا كتير اليوم نبني استراتيجية بتتعلق بمجال الدواء وتكون بناءة وناجحة مثل ما هي بكل البلدان اللي بالمنطقة. على صعيد الصناعة واللي حكيت عنه رشا وحابب ركز عليه أنا، هو البارت اللي بيتعلق بالصناعة الوطنية. اليوم شرحت على النقطة يلي هي الانكريز بالماركت شير اللي أخذناها نحن كصناعة وطنية من 10% ل 30%. هيدا واقع ومثبت بالأرقام، ولكن هيدا الشيء أخذ جهد كتير كبير من الصناعة الوطنية على عدة أصعدة. أول شيء على تضحيات معينة عملتها الصناعة الوطنية من ناحية إذا بدك التضحية بالأسعار. نحن اليوم حملنا كتير بارت بيتعلق بالسعر لما كنا عم نعمل ديسكاونت على الماركت ريت، لما كنا عم نسعر الدواء. وهذا الشيء يمكن خلى كمان إنه المواطن يتحمس ويكون عنده accessibility للدواء ويقدر يحصل عليه بالصيدليات. غير شغلة، صار في ثقة بالدواء اللبناني لما بلش يتاخد وصار المجتمع أو البيشنتس يستعملوه. شافوا فعلا إنه الافيكاسي تبع الدواء هي ممتازة. اليوم نحن إذا فينا ناخد هذا الإكزامبل ونحاول قد ما فينا نبني عليه تنقدر الاستراتيجية تبع الصناعة الوطنية نركز عليها بطريقة إنه تصير هي مثل ما بيقولوا السنتر أو البيلر تبع صناعة الدواء بلبنان. لأنه كل بلدان المنطقة مثل ما بنطلع وبنشوف الركيزة الأساسية عندهم هي اللوكاليزيشن. كل بلدان السعودية، الإمارات، العراق اليوم كلها عم تروح نحو هذا الشيء. واليوم كتير مهمة لأنه إذا قطعنا بأزمات إن شاء الله ما بنقطع بالمستقبل، بس بيكون عندنا نحن سيلف سفشنسي تنقدر نواجه هدول المشاكل. بقى هلا بنحكي بشوية تفاصيل أكثر بتتعلق بالأمور الثانية اللي حكيتها، بس هذا البارت اللي تابع للصناعة كنت حب وضحه.
صعب القلب عربي انجليزي. شكرا طارق، واكيد رح نرجع نحكي اكثر عن الريجوليشنز الخاصه من وجهه نظركم. دكتوره جمانه تفضلي.
You actually, Tarek and I, on behalf of SPIL, he mentioned all what could represent the point of view of SPIL. Nevertheless, I want to clarify that everything that Dr. Rasha mentioned in her paper is aligned with what we were passing through. We will elaborate further regarding the export because we need a dramatic support from the government, from the authorities to support export because Lebanon, as you know, is somehow limited. So in order to survive, you are 13 manufacturers and the number is increasing. So in order to survive, we need support to export our products, knowing that we have all what is needed in terms of quality of our products by following and complying with the WHO rules and guidelines, the good manufacturing practices. So this point is very important for us to be tackled and be supported on.
What's the current percentage of products that you export currently?
We're 80-20.
80 local market and 20.
We're importing 80.
Yeah,
exporting 20.
out of the products of the production of the 13 Lebanese factories, how much of this is actually exported outside? Roughly.
we're ما بعرف شيء أقل من 10%.
Less than 10%. So lots of potential for improvement on that perspective. Thank you. Dr. Hussein, how about international pharma?
I need to comment on the local manufacturing. Although I come from a multinational company and I'm representing the Lebanese Pharma Group.
Yes.
So the main issue that the government need to support these our local manufacturer is to tell other countries that we should be treated the same. معاملة بالمثل. So if we are to import from your country any pharmaceutical product, then you should allow our production to enter your market. And I don't want to comment more than that on the local manufacturing. I want to come back to to whatever Dr. Hamra was presenting. She presented it in a very political way. What I can say is that I don't know if you know that the only sector in Lebanon that delivered 400 million with no financial support on the hope that the central bank will pay it one day was the multinational companies along with the local manufacturer. Yani I will speak one or two sentences in Arabic. الدعم كان موجود لثلاث اشياء اول شيء للمازوت وللقمح وللدواء مش المازوت سوري الفيول يعني المشتقات النفطيه. I don't know if you know that not a single shipment entered Lebanon from these two, from القمح and from مشتقات النفطيه without being paid or an LC established, with the exception of the pharma. So that's why what Dr. Rasha was commenting, that we reached a 400 million debt to a certain extent that we could not finance anymore the country. Things, I don't want to speak later what happened, but
sorry, Dr. Hassan, to make sure it's clear for everyone. So this is money paid by the international and the local the international pharma local producers
government,
until the central bank pays back the money.
Yeah,
absolutely.
Which I mean, we all know what happened. Dr. Rasha knows better than she was at that time. What I will not discuss the points. Anna, what I'm interested is that we hope, Dr. Rasha, and one day we will implement what you have inside. We all implement. We need a central lab. It's not acceptable today to any product to come into Lebanon without testing. That currently we're doing testing, but not for every batch. I'm responsible. I mean, in my company that I work for, I represent a whole region. Most of the region, each batch entering the country need to be tested. If we are to import any medication, and now we're not referring to reference countries. Maybe 10 years ago, we did not really want the central lab when they closed it, because most of the products coming to Lebanon was from reference countries, which we know that, I mean, to a certain extent, there is a liability. Today, we are importing from countries that, I mean, they are not reference countries. This is the least we can see. And some of these products are entering the market are only sold maybe in the country of origin. So there are no reference countries. They're not even sold in other countries. So these products, like for example, in Jordan, every single batch is tested. So I hope what the paper that you have done, we look at it again and hope to find someone who would support the implementation. The problem in our country is that we have the talents. We were the hub of the Middle East. We had the medical tourism. True, we had innovation products, new products in Lebanon before even Saudi, before the Gulf. We have in Lebanon, we have talents. We have two schools. We have the American school. We have the French school. Each one has his own thoughts. So that's why people were coming seeking medical treatment in our country.
We need to keep these multinationals. Unfortunately, even research, Dr. Hamra knows there were many products that came into the world. Lebanon was part of one of the hub of research. We had Hotel Dieu de research, the AUB research, some teaching universities. We were doing research in this country and publishing and getting the FDA approval for the new medication. Now with what happened during the crisis, which we hope that it's over now, we don't want to discuss. Hopefully we will come back again, like like what you were saying, Dr. Rasha. But Anna, I really emphasize that if we read the study of Dr. Rasha, or what the analysis, whatever you call, I don't want to call even a paper, it really tells the story politically. Again, I repeat myself, politically or diplomatically. Okay, but diplomatically. But I really do hope that we implement the Lebanese Drug Association. We're not against any product coming to our country. We want to be treated the same with other countries. We want the product coming to Lebanon is a good product, validated product. Unfortunately, nowadays we're registering with all respect, with not much of a validation. And this will create a big issue. Now, with the new innovative product, I can tell you, Tarek, again, that now it is opened. Like Dr. Rasha was saying, that we have moved the cloud has moved. Now we can register new products. Now the problem is with the purchasing power of the individual and the MOH and the NSSF. This is all a problem, but I think with years it will solve. But again, we need to implement. And thank you.
Thank you. The cloud is starting to move. There's a lot of work needed to make sure it moves entirely. Fantastic. Dr. Soula,
yes.
Go ahead.
So thank you, Rasha. The report is really, it addresses all the issues that the pharmaceutical industry today is facing. And I would like to put things in context to say that the pharmaceutical industry is the most regulated industry. So quality comes at a cost. And today, the local industries are heavily investing, not only in equipments, but in quality systems. Unfortunately, they are facing many challenges, and nobody is supporting them in these efforts, everyday's battle, in that they have to face a lot of competition on the local market. It's a fragmented market. And here we need to stop and think, why do we need to have 17 different brands of amoxicillin tablets when you have 2 local manufacturers? Why do you need about 25 different brands of rosuvastatin tablets when you have 4 local manufacturers? And we don't have the resources to control these. And the small resources that we have, let's use them somewhere else. We need to make sure that we can inspect all those factories that are exporting to our countries. And the chance we have to have a local industry is that we can control the quality. We can easily go and inspect it. So it would really improve. It would really improve the drug bill of the country, and it would also improve the trust people have in the local industry. So it's really a win-win situation for the government to give all its support to this local industry. The second challenge they do have is that there is very little innovation. They are producing product within the same therapeutic categories, and innovation is lacking. Today in Saudi Arabia, they're opening the first facility for cell and gene therapies. And this facility will cover only 9% of the market. So there are opportunities that we go and get. Perhaps the government could give priorities to 2 or 3 companies and give them exclusivity if they invest in specific technologies, if they invest in ophthalmic product production, in oncology. We don't have one single facility that is producing oncology products. And we have learned from the COVID that we need to be as much as possible self-sustainable. So there are a lot of challenges that take a political will. There are others, and I will finish with this, there are others that are perhaps easier to do is the digitalization. I'm calling for digitalization of the regulatory process. Please go and check what's going on in the GCC countries. On the website of the Ministry of Health of Oman, it's clear, it's crystal clear. You want a GMP certificate, you want a registration, you want to renew your license. It's a click. Please, let's minimize human intervention in Lebanon on those things. It is time consuming, it's expensive, it's a waste of time for everyone. We can do a lot with digitalization of these procedures. Also, if I may say, having a ministry signature on files, this should not happen. This should not happen. There are fast-track reviews that should be done, but not a signature that allows for this. So these are things that are relatively easy to do, and voila.
For anyone who has experienced the drug registration process in Lebanon, I think hears you well on what you're saying. Please go ahead.
اللي قالته دكتور جمانة, in order for us, عم بحكي as a country, to increase the exportation of medication to neighboring countries أو حتى الEU. يمكن العالم بتسأل إنه أوكي يضبطوا حالهم المصانع الأدوية. But that's not the recommendation. That's not, I mean, the requirement. The requirement is that half of the homework is to be done by the Ministry of Public Health, and if you strict requirements that the ministry need to do.
Please, do you mind sharing more? I had a question on this, so please go ahead now. It's further.
So actually, it's not only the local manufacturers to improve their production and everything. For other countries to trust our products, the Ministry of Public Health need to improve كل شيء regulatory function. In order to improve regulatory functions, you need to have human resources, you need to have experts. نحن بالدولة اللبنانية عنا ممنوع التوظيف منذ أكثر من 10 سنين. So how can we improve our system? How can we reach digitalization if we don't have human resources? إذا وزير ما في يوظف حدا technical. So
absolutely.
Again, we have all the solutions. We know all the recommendations. Again, we did not invent the wheel. It's all there. But in addition to political will, we need really the government to move forward. Obstacles هي حطتها لحالها. And we are hoping with the LDA we can get out of this in order to fulfill all the requirements.
I'll capitalize on what you said for a question on LDA in particular. So LDA keeps coming up. Lebanese Drug Authority regulation apparently is the core issue. They're mandated to regulate the sector. Where is LDA now? What's missing to actually actualize it? And how would this transition be from the current regulator MOPH into LDA? أكيد in short.
International recommendation هو إنه يكون عنا drug authority that is independent of the government حتى ما يصير في عنا minister to sign, ما يكون عنا political influence. So that's why the Lebanese Drug Authority as a law على الورق saw the light like in 2022. And then it took another 3 years for بنسميهم المراسيم التطبيقية اللي هي بتطلع from the Council of Ministers to establish this entity or authority to start working. So these were issued last September, يعني 2 months ago. But again, this does not mean that the authority will be there tomorrow. First of all, we need the appointment of the entity, the membership. We need to find very simple logistics. We need to find the location, the venue. We need a seed budget for this entity to really start working on drafting SOPs, terms of reference, follow international regulations, have the e-registration that everyone wants in Lebanon. But in order to reach this, they need a budget. Where is the budget? No one discussed this. In addition, all of the current functions that are led by the Ministry of Public Health are now the responsibility of the Lebanese Drug Authority. We need a roadmap. Are the functions going to transfer directly to the LDA? Are we going to have stepwise approach, like giving one function at a time? When we talk about the pharmaceutical supply chain, we talk about functions, starting with manufacturing, regulation, inspection, etc. So there's no clear cut, no vision about what is happening. And even if the authority get appointed tomorrow, I would say they need at least 1 year to put everything in place to start taking the lead, start producing, collecting fees in order for them to be independent. So we're still a little bit behind.
A long way to go. Thank you. Tarek, going back to localization, and you come from a sector which has proven to be a success story when it comes to localization and fulfilling the market needs. Any specific lessons learned from the serum manufacturing sector that can be shared with other sectors and can be generalized?
هلا نحن فينا ناخذ ستوري تبع الاي في سولوشنز كمثل تنقدر نبني استراتيجيه لللوكاليزيشن تكون اقوى للبلد. نحن اليوم 3 مصانع بنصنع امصال بلبنان. اول واحد بلش بال71، ثاني واحد ب72، في واحد ريسنتلي هلا فتح بسنه 2022 تقريبا. الفكره وما فيها انه نحن ما في مصل بيتركب على بيشنت بلبنان الا مصنع بلبنان. وهذا الشيء صار له 50 سنه. اوكي، يعني هيدي الشغله عبره كتير مهمه تنقدر نبني عليها ونوثق بالصناعه الوطنيه وبالكابابيلتيز وبالكواليتيز اللي ممكن يكونوا عندنا. هلا شغله مهمه كمان تنبني على هيدا الشيء، نحن عم نفكر بالنقابه على ترشيد الاستيراد. يعني اليوم مثل ما تفضل وحكي حسين، في كتير برودكتس عم بيجوا من بلدان غير مرجعيه على لبنان. اوكي، وهيدا الشيء ومثل ما قالت سولا في كتير موليكيول في منها اكثر من 10 و20 طعمه وبلا طعمه. لما بيكون في نحن عم نقترح انه اكثر من معملين او 3 عم بيصنعوا هذه الموليكيول، تيكون في نوع من الرياحه للدوله لتقول انه انا فيني ركز واعمل ارشاد للاستيراد، ترشيد الاستيراد. كيف الطريقه بدها تصير؟ منقرر انه اوكي هالثلاث معامل بيكونوا هن عم بيصنعوا لوكالي، وبنفتح الباب للاوريجينيتور ولا 1 or 2 موليكيول ثاني تقدر تفوت على البلد. بهالطريقه السوق بيتنظف وبيصير فيه للسوق للصناعه الوطنيه قدره انه تقدر تكبر بسوقها، تقدر توصل تكبر الريفينيوز تبعولها، تقدر تفوت بعدين بالمور كومبليكيتد فورمولاز. بس لما اليوم نحن عندنا كاباسيتي كتير كبيره وعم نشتغل على تلتا، خلينا نقول ما بحياتنا رح نقدر نعمل ريتيرن اون انفستمنت تنقدر نرجع بعدين هالمصاري نضخها بمحل تاني ونكبر. النقطة الثانية المهمة بهذا المجال هو
سوري طارق just to interrupt. So anything that hinders انه هذا الشيء يصير هلا ولا لازم ننطر القضية لتصير؟ الوزارة هلا قادرة تاخذ هذا القرار؟
بصراحة بعد ما في شيء، بعده حكي، بعدنا يعني عم نتحاور مع الوزارة على هذا الموضوع، ما في أي قرار، ما في أي ديسيجن بهذه القصة. بس انه هوبفلي يعني مثل ما في البيبر تبع رشا نحن كمان عم نحط على الطاولة وير ادفوكيتنج لنقاط معينة تنقدر نكبر هالماركت شير للصناعة الوطنية. كمان بدي زيد شغلة، نحن اليوم بالأدوية اللي بنصنعها اوكي كومبيرد للإمبورتد بلبنان بنشكل تقريبا 70% من السوق. نحن كنا أقل بكتير قبل الأزمة، بس اليوم قدرنا نوصل انه نغطي 70% من هالادويه اللي نحن بنصنعها. ولكن البارت الثاني اللي ما بنصنعه هو الفورمولات الاصعب، الأونكولوجي والبايوسيميلرز وهالاصناف كلها، يلي ممكن نحن بالمستقبل اذا قدرنا كبرنا بعد اكثر الماركت شير تبعيتنا نقدر نفوت ساعتها ومع التاك ترانسفير من برا نقدر نختص ب انه نطور هالفورمولات.
So it's a process
وبده وقت اكيد وبده دعم مثل ما قالت جومانا من الوزاره واكيد.
Thank you. Joumana, you focused on export, and I know we tackled export with bilateral agreements. Anything to add على regulations needed to encourage export and hence enhance the contribution to the economy from the Lebanese factories?
Actually, one of the most important things for encouraging export is the presence of central lab because Central Lab usually adds this seal of quality and confidence of other markets to export. We need the bilateral agreements, of course, and reciprocity in treatment, as Hussein mentioned. And I'll give you an example how the neighboring countries are becoming so protective of their markets by giving incentives for localization, as we talk for Saudi and UAE, and there are a lot of incentives even in Iraq, and there are a lot of incentives, especially in Saudi. Whenever you localize the product, it will become the only product that is adopted in tenders. There are marketing exclusivity for around 5 years. There are pricing incentives for localization. So we need such a treatment in our country in terms of localization, and this leads us to reciprocity in treatment in terms of registration. We are ready today under with the collaboration with health authorities that we are being inspected by WHO, and our aim is to become a PICS country, whereby it will become a reference country, and it will
You mind sharing what PICS is بس
it's the pharmaceutical
inspection cooperation scheme, which allows you to align the standards to international standards, and it allows for mutual recognition of inspections. This is what's good about it.
So it's the gateway for reciprocity and for making sure you have access to the other markets. Fantastic.
Yeah, as industry, but we need the help also of the authorities. So we cannot work alone. We need the support.
Thank you. Go ahead.
If I may add one thing about PICS, it's becoming urgent. Jordan last week became a member of PICS. Saudi Arabia 2 years ago, Iran 2018. The whole region is has already applied to the PICS. African countries are already pre-applicant: Tanzania, Rwanda, and Nigeria.
And the process.
What are we waiting for?
Where does it need to start in Lebanon?
From the Ministry of Public Health, because they will be training the inspectors so that the inspections would be mutually recognized. It is urgent. LDA should become operational tomorrow.
This is what I wanted to comment. The only sentence is the will. Unfortunately, we have the ideas. They are even published, but we don't have the diplomatic, or again, I go back to political will. We can go tomorrow, LDA. We can do this, start tomorrow. We need to start at a point. Dr. Rasha was saying, if we start today, we need 1 year. So till today, we did not even, we don't have a committee yet. هلا اوكي طلعوا الرسوم التطبيقية، المراسيم التطبيقية. تعيينات we'll fight for هلا في انتخابات نيابية. So the LDA is a must لحتى يكون عندنا credibility. أنا يعني we cannot يعني I'm representing the multinational. Today we are suffering. In order to go back to the Lebanese market as we were before 2018, بدنا شبكة أمان. يعني we need a trust that if we bring an innovative product, this product, not the second day we will have a copycat coming from any other countries which is not reference or have not even lost the patency, and it might come in a way or another. As multinational company, in order to do research, we need to see that the government is supporting us. We find sometimes ourselves we are not appreciated in what we are doing. We will be publishing a study very soon on how much is the investment of these pharmaceuticals. Dr. Hassan said, or I think Dr. Rasha said, that before 2018 importation was 1.5 billion. But nobody said how much was the investment being put in research, human asset, the team that was here. And I tell you honestly, during the economic crisis, only because of the Lebanese entrepreneur who were at a very high position in these multiple multinational companies, that's why we were able to keep supplying Lebanon with the medication, even without being paid.
Fantastic, Lana. I was going to ask you about what would, from the point of view of a multinational company, what would it take to actually invest in the country, other than what has been said in general?
The only sentence is credibility. We need to see credibility. We need to see credibility. Unfortunately, again, LDA, and I mean, LDA, it should be, we should have started it 2 years ago.
Absolutely.
You said trust. Trust means quality, it means credibility, it means accountability. When you have a bacteria in bottled water that leads to a national debate, how do you want us to be credible? And I investigated personally. I still don't know whether the water was contaminated or not, but it raises horrible questions. I mean, it's crazy. It's crazy. The microbiological test is the easiest test, perhaps, that any one of us can do. And it led to a national debate, and you want us to be credible. So these are things that should be avoided. These are things where all the parties are at stake here, and we should not accept these things to happen.
And to move into what would actually guarantee quality assurance, so central lab has been mentioned a couple of times. Any other regulation needed to maintain quality assurance?
Quality, I think all the universities have excellent equipments, have excellent experts, and I think that for quality, for drug development, for the development of new generics and so on, I think there should be a much closer coordination between academia and the private sectors.
Fantastic. Please.
But sorry, I just would like to add one thing, is that LAU will be opening within few months the first bioequivalency center in Lebanon, and this center will be headed by Dr. Sam Haidar, who is an expert in the field. He has spent more than 27 years at the US FDA, so he's bringing this expertise, and this is a way to support the generic industry.
So collaboration with academia as a tool to save on resources and to actually move things forward. Fantastic. Please.
Same point. Everyone wants a central drug quality lab in the country. It's ideal to have it independent, established. But meanwhile, if that's not feasible, we need to collaborate with existing universities. Have anyone seen the labs in the Lebanese University, بالعرب University, بالLAU, بالUSG? They are equipped. They are amazing. We have the expertise, so we can collaborate with academia on this. Once we mention it, they say, "Okay, what about conflict of interest?" Okay, we can manage conflict of interest. There is nothing wrong of having conflict of interest as long as you declare it,
control it,
you manage it. It's better than having nothing. So we can start with concrete steps, train people on how to run a central quality lab with whatever is existing, and everyone wants to contribute. The local manufacturers wants to contribute because it's their reputation with other countries. International pharma would love to contribute because they want to test their own medication as well as any other batch from any other non-reference country going to the country. So again, I emphasize the solutions are there.
And you can correct me if I'm wrong. The budget is secured for the central lab. The money is there.
The location,
if I'm not mistaken, if this is what, no?
You missed the discussion at lunch. Go ahead.
Unfortunately, there is a misconception, is that the WHO, through a grant actually from the European Development Bank, we secured a big budget, and it's the first of its kind to establish a central lab, but it's a public health lab, which means it tests for emerging and re-emerging diseases, but it's not specialized in drug quality control. So they have to be separated.
It's a different type of lab.
تزيد شغلة على الكواليتي. عم تحكوا بالكواليتي، نحن عنا ريسورسز بلبنان وعنا البيبل الموجودين واللي صاروا عندهم ليفل اوف نوليدج كتير قوي بالكواليتي. وما بس هيك، عنا نحن كونتينيوس تريننج عم نعمله بالنقابة، ان كان للببليك او للبرايفت سيكتور، دائما جوينتلي عم بتكون حتى قد ما فينا نعلي الليفل. شغلة تانية صارت ومهمة كمان تنعرف إنه WHO كانوا بأكتوبر بلبنان عملوا workshop jointly بين الببليك والبرايفت سيكتور كرمال الامبلمنتيشن تبع كل هالقرارات اللي محطوطين بالبيبر تبع رشا، وبنفس الوقت it's completely aligned مع الاستراتيجي اللي انت حاططيها. سو هالتو بيبرز اللي اذا الواحد بيطلع عليهم ما في شيء اكسترا ينحط. وبنفس الوقت هال WHO اجوا معهم 2 inspectors حتى يبرموا على المصانع كلها، وصار في تقريبا 4 man day بالمصانع كلها اللبنانية، وانبرم عليهم وانعمل اوديت على 2023 WHO GMP. سو هلا الكابا سوري الريبورت عم ينكتب وبده يطلع اكيد كاباز فيهم حتى المصانع اللبنانية يطبقوهم تيعلوا الليفل تبعهم.
انت
Central lab, يعني establishing a central lab in Lebanon, it's money staying in the country, because today importers and local manufacturers are sending their products for analysis in reference countries abroad. So it's costing us a lot. So can you imagine if we are analyzing here in Lebanon, it's money staying in the country.
And the problem has been finding the right location, if I understand well. It's hard to regain trust in such a context. Going back, but to many of you have regional expertise, and we've mentioned a lot that what's needed is basically actual implementation and actual regulations that would help things out. So just a question for all of you, whoever would like to take it. What are lessons learned and practices from other countries? I know if we look at the region, we see a lot of advancement, a lot of investment, a lot of focus on quality assurance, on localization, on regulation. Any specific lesson learned that we can benefit from, we will do a round and then open it up for questions from the public.
Mentioned the biggest lesson that we can learn maybe from Saudi Arabia. They have started with SFDA since 2011, I think. And today, as mentioned by Soula, they are PICS. They are observing, they are maturity level 4 at the WHO, observing member in the G20. So whenever there is a will, the system will follow. And we have the expertise, we have the talents, we are exporting to those countries. So we know the guidelines, we know the implementation, we have the systems, but we need the government as well to help us. Yani we cannot do everything alone. It's impossible.
Very clear. Any other additions? Okay, so we'll open it up to questions from the public. Okay, yeah.
Much first for this very interesting panel, and I hear you all talking about the LDA and that we need to have the LDA. And so then Nabil says we need a location, and some of you say that we need other elements. I mean, what are we talking about when we talk about location? Is it an issue of cost? Is it an issue of political bickering between different factions? I mean, what exactly? I mean, if all of you agree that it's needed, how come we can't move forward? Thank you.
You need a vision. When you say you want to activate the LDA, we all agree, the professionals here. And if you see the local manufacturers wants the same with the international wants, the same with the international organization wants, the same of the Ministry of Public Health wants, everyone wants it, but you need a vision, which means, okay, we have the law, we have the implementing decrees, but it need to be more detailed. That's fine. You say, I will detail it later. We need the appointment of the people. You need to decide, okay, I want to activate it really. Let me do a cost analysis, which means I need a location. I need a budget for the first 2 years, because this entity will start working on reviewing all existing laws and regulations that is related to the pharmaceutical sector. See what is still valid to be used, what is out of date that needs to, if it's a law, it's a problem because we need to go to the parliament to change it. If we want to ensure electronic registration, we need to fix the laws again. So someone needs to do, we need the appointment again of these people. We need for them to start reviewing all what is existing, say, okay, I want to start with this, do the regulations, do the laws, ministerial decrees, whatever it is. You need, again, a budget for at least 2 years, I would say. I'm not an expert, but you need an operational budget. I don't, this is where you need to do a cost analysis study.
No, it hasn't. It
Let's-
hasn't went that far. Not to what I know of. And I would just add that it would need an operating model, a full operating model in terms of mandates, functions, and how would those mandates transition from the existing authorities holding them, the Ministry of Public Health and others. And that as well, step is not fully clear. Please.
The very key component in this is that this authority is allowed to collect fees for services they provide in terms of they are doing a testing, inspection, whatever it is. So who will set this cost? Who will set this fees? You need a study. You can take the model of, we talked about the Saudi FDA. We can take another neighboring country, Jordan. They did their own FDA. Let's take a small country as ours, do this costing analysis. It's not that khalas and no, we did an implementing decree, yalla, we are hoping for, there's a lot to be done. So it's a whole strategy.
Data on production, supply chains, pricing, export readiness.
And the question is, where is the data or what's
Yes.
Okay.
If it's available for pharmacists, the pharmaceutical sector in Lebanon, if I want to do a study on the economic contribution of the sector or a cost analysis or what value added would more exporting or a new central lab generate for this sector, what is the available data that I can use to do such type of analysis?
Usually it's IMS data. And I don't think there is a full public data. For the prices, you can find them on the MOH drug list. For the rest, it's the IMS data that is based on subscription.
Data is available, but it's not analyzed. And you can find it in two sources. The Ministry of Public Health, because they have all the data on what is registered on the country. And for any shipment, they need to take an approval from the ministry.
So it's all formal and registered.
And you can take it from the order of pharmacists. You can do triangulation because, again, any shipment that is coming to the country, the invoice goes to the order of physician in order to pay some kind of fees or taxes or something. But it's there. We have it. You need someone to analyze, for example, amoxicillin, how much we are having entering the country. You have the data from the local manufacturers. Let's analyze, saying, okay, you can also approach the manufacturers saying, okay, how much you pay on testing outside the country?
Exactly.
What if we say that we offer this service in Lebanon for, I would say, 10%, for example, less? Let's go to the labs, to LAU, to Arab University lab, say, can you do this testing for this amount?
I would say data is there, but data is the data governance. Exactly. It's not fragmented, and thus there is no proper data governance framework to make use of this data and to actually move to another level. And that's a major gap to capitalize on.
Realization. The invoices, you can get all the information needed, like Dr. Rasha was saying, from any of these three sources, from the MOH, from the Syndicate of Pharmacists, or from the Syndicate of Doctors, because they all approve the importation of these products. But unfortunately, we don't have a computer that you can categorize. That's why it's simple digitalization we don't have, unfortunately. We're still signing, stamping, and these things.
Formal sectors in terms of like exactly, we know like other sectors you would see that they have 60% informality. This is not the case of the pharmaceuticals. So it would be very interesting to have this digitalization that you are addressing, data sets that economists or anyone can, if we want to do any type of analysis for the pharmaceutical sector, we can use these data sets that provide evidence-based solutions, quantitative analysis. Yeah.
You need to have a will. Nah, we as multinational companies, I don't know if you, Dr. Rasha, did we internally, and you know about that. Internally, we said, let's sit all together, study what did we lose in those 5 years for the economy of Lebanon. I mean, we gathered all the 15 remaining, or now it's 11 even remaining multinational, and we have put how much budget we invest, how much research we do, what are our importation,
human resources,
and we tried to quantify it with one of the researchers. I don't know if we will publish it, but this is just to give it to the Ministry of Health, telling them how much how much we lost. Yeah, I mean, not lost as pharmaceutical, how much Lebanon has lost.
Contribution to the economy, that's
contribution to the economy, exactly.
Absolutely. Evans, yeah.
To turn it on. Thank you very much for the interesting discussion. I have just one question. I feel this sense of frustration on the panel on the political kind of will. Now, my question is, we've heard also the minister today that a lot is about the implementation, not so much the ideas. The ideas are out there, but the implementation is lacking. Now, I wanted to ask you, how is your kind of experience with the new government now in place? Have you seen it? Have you seen a change there? Is there a willingness in the ministry to kind of address these issues more than maybe before? I mean, of course, everything does take time on the political level, especially here in Lebanon. But do you see a kind of a mind shift within the ministry that, you know, you would have some kind of positivity to take out of today?
I refrained from asking this question, but it came, so شوف شو وقت عمل.
Was an ex-ministry staff, but not anymore. But anyway, definitely we saw a big change and commitment from the current Council of Ministers and the ministry. And a lot of changes actually happened from February till now. But what's the problem in Lebanon? Is the fast changing in the leadership. Now everything for us as a WHO, every project we put on the table, oh no, let's wait if the elections will happen in May, because if it happens, we hope, then the Council of Ministers will change, then the minister will change. So let's wait. This is the problem. We don't have a long-term leadership inside the ministry. And again, I mentioned it before, is that there is a high-level decision from the government that to stop recruitment for public servants. It was 10 years ago, if not more. So if you want to make changes, the current staff cannot do all of these changes. You need new human resources. You need experts to be on board. So how can we recruit? What can we do? So we see a will, but again, there are a lot of constraints that, again, prohibit. And then we fear if the elections happen, okay, great. Is the government going to be formed directly, or we are going into another government freeze till they agree? And so
political stability affects long-term planning.
Of course.
Absolutely.
At the bureaucracy that we have now, I mean, centralization versus decentralization. That's the question. If you give a committee to do the mission, it does not need a minister that comes and go, even if from a different political party. But unfortunately, this is like what Dr. Rasha was saying. That is a reality. Unfortunately, this is a reality.
One small question to the Syndicate of Pharmaceutical Industries in Lebanon. From my past experience trying to cover the output of local pharmaceutical industries, including their exports, which in one case, a company told me that they were 60-40. So in percent, very different from the less than 10. Please, the transparency towards media that comes from SPIL and specifically from the president down to the owners of private pharmaceutical industries has been treated as a trade secret by most of these companies. And this is not helpful for the growth of the industry. So in the interest of Lebanese GDP growth and export growth, please change the policy and impose a policy from SPIL to have more data transparency and communicate it to the media. Thank you.
Case
Interviews with pharma companies.
regarding the export figures.
Well, you can go from regarding their partnerships with international biogen companies, you can go to export-import relations, you can go to annual production. We have talked at Executive Magazine over the years to maybe 10 of the pharma companies. My requests for interviews with the head of SPIL, with the interviews with the head of the pharmaceutical order and pharmaceutical importers. The miss rate of getting such interviews and getting data was very high, higher than with all other manufacturing industries that I've covered for the last 20 years.
Okay, I don't know the cases that you are referring to. Nevertheless, we can assure here that in every interview or report that the syndicate is giving, we are very keen on transparency of data. I'm not sure whether due to fast changes in the environment that we are living in, things might be changing, but we can take this offline, Tarek and I, with you if you would like. Thank you.
Fantastic. So mindful of time, any other questions? Yep, go ahead.
I have one question. Sorry about that. I wanted to address it to the vision, when we spoke about the vision. What I see is Lebanese people always have visions. We always have visions, but we don't have actions, unfortunately. What we need to do is usually we should create a roadmap with small milestones and then focus on these. I understand the fact that we don't have a budget to hire professionals or experts in the field, but Lebanon is always in the case of unexpectancy. So where is this going to take us? Year after year after year after year. We're going to end up doing nothing for years and years and years.
We need a planning ministry, like before the war.
There is, for the first time in 2022, there was a national health strategy that put the vision for 2030. It was the first in Lebanon, and it's for the whole sector, not only for the Ministry of Public Health. And for 2 ministers of health, they are following that vision, and they are doing a yearly review on what was implemented and what was not implemented and what's still pending. Same thing happened for the pharmaceutical sector. There was a national strategy for the pharmaceutical sector, and it was the first time that it was developed with agreement with all stakeholders, also in 2022. But no one is talking about that strategy, maybe because it was under the leadership of the Order of Pharmacists. So maybe no one adopted that strategy, although everyone was on the table and everyone worked on developing it. I agree with you. I believe in baby steps. Again, the solutions are there. We have all the capacity. We know all the know-how. We just need to have, I will not say only the will, we would just need really like a push. Okay, we want a lot from the government, but what are we contributing to help? Like they say, I like this concept, is that a corporate social responsibility. What about professional social responsibility? If every one of the professionals contribute by the expertise, all experts here have the know-how, the experience, how other things happen in other countries. If we contribute of our time, I would say the LDA will not work with only the committee that they want to
Establish.
it will not be enough if they want to review everything. We need to have volunteers. Of course, they will not be paid. And again, we don't have the budget. But if every professional say, okay, listen, I want to contribute. I don't want anything in return. I really want to improve the sector. I think we have it. We just need someone to say, okay, let me talk to everyone, to all universities, to all academia, to all professionals. I think we can reach with baby steps, but it's achievable.
Fantastic. With that said, I think it's a good summary of what the panel has screamed out loud in terms of solutions are known, the readiness is there, the potential is there, better regulation. LDA is tasked to regulate, delay informing it, so there is no clear stewardship of moving things forward. And of course, with all the macro challenges related to economic policies and the situation and the bureaucracy and others, and the resources in the government, as we mentioned, a lot of hindering factors, yet potential is there, so thank you. We'll keep the positive note of thinking how to contribute and what can be done, hoping things can move forward. Thank you for your contributions.
Okay, just closing, I would like to inform you that we will have the recordings of the conference on our website soon, and that we will make sure that the key recommendations generated by this conference will make their way to stakeholders and decision makers who could not be with us today. I want to thank the panelists, and I want to thank Nabil for a very, very informative panel and rich panel. And we sense the energy and the frustration at the same time, but the energy is there, and that's the start. I think that's the start, exactly. Allow me then, if you don't mind, to thank a few people in conclusion. Again, I would like to thank the Friedrich Naumann Foundation, specifically Christophe, May, and their team, and to say it's always a pleasure working together. And so thank you for that, and for your unwavering and for this fruitful partnership. And the special thanks goes to the LCPS team for all their efforts. Allow me to single out Lina Maddah again for her pivotal role throughout this project and conference, and also to our broader team, Lubna Wahid, who played an amazing role in getting us here and keeping this place running as in clockwork. Vatche Chelderian, our researcher, Ali Awada, our social media representative, and Noor Sayed, and also who worked tirelessly in making this event a success. Finally, a word of thanks to our media team and interpreters who did a great job, our photographers, the technical team, and last but not least, the hotel staff for their hard work. Thank you all for being part of this interesting day, for all your inputs and insights, and I really hope that together we can keep moving things forward. Thank you.